Have you ever wondered why women are more prone to suffer from ACL tears compared to men? This unsettling reality is not just anecdotal but backed by scientific evidence. The ACL, or anterior cruciate ligament, is one of the four main ligaments within the knee that connect the femur to the tibia. An ACL tear, often a result of sudden stops or changes in direction, can be a devastating injury, leading to months of recovery and in some cases surgery. What's more startling is that these injuries occur significantly more often in women. The reasons for this prevalence are complex and multifaceted, including anatomical differences, hormonal factors, and biomechanical variances, to name a few. These aren't mere conjectures, but are grounded in robust scientific research. So, if you've ever been puzzled by this disparity, you're not alone. Stay tuned as we delve into the shocking realities behind this phenomenon. Let's unravel the mystery behind the staggering statistics. The first shocking fact is that anatomical differences between men and women play a significant role. Women generally have a wider pelvis, which creates a greater angle at the knee, known as the Q angle. This puts more pressure on the anterior cruciate ligament, or ACL, increasing the risk of a tear. Additionally, women have smaller ACLs and less muscular strength to support the knee joint, which can lead to instability and injury. Now let's move on to the second fact. Hormonal factors significantly contribute to the susceptibility of ACL tears in women. Studies show that women's estrogen levels fluctuate throughout their menstrual cycle, affecting the laxity or looseness of their ligaments. In the first half of the cycle, when estrogen levels are high, ligaments become more flexible and more prone to tears. These facts are not just anecdotal, they are backed by robust scientific research. A study published in the Journal of Orthopedic Research found that the risk of ACL tears was significantly higher in women with high estrogen levels. Another study in the American Journal of Sports Medicine confirmed the correlation between a wider Q angle and the risk of ACL injuries. These are just the tip of the iceberg. Let's uncover more. Ready to dive deeper into the hidden truths behind ACL tears in women? Let's peel back the layers and reveal the next two shocking facts. First, did you know that societal norms and lifestyle choices can indirectly contribute to the prevalence of ACL injuries among women? Extensive research has shown that women are often encouraged to engage in less physically demanding activities during their formative years. This can lead to a lack of muscular development and strength around the knee joint, which, in turn, can result in a greater susceptibility to ACL tears. Secondly, the role of hormones cannot be underestimated. Studies suggest that fluctuating hormone levels during menstrual cycles can affect the laxity or looseness of ligaments. This, coupled with the fact that the ACL is smaller and weaker in women than in men, means that women are at a higher risk of experiencing an ACL tear. Isn't it fascinating how societal and biological factors intertwine to influence our health and well-being? It's a stark reminder that we're not just biological machines, but complex creatures shaped by a myriad of influences. But we're not done yet. There's more to this than meets the eye. We've just scratched the surface. In the next scene, we'll delve into the final revelation, a truth that might just change the way you look at ACL tears forever. Brace yourself for the final revelation. The fifth and perhaps most startling fact is that women's menstrual cycles can impact the stability of their ACL. Yes, you heard that right. Hormonal changes during different phases of the menstrual cycle can affect the laxity or looseness of the ACL, making it more prone to injury. During the first half of the cycle, estrogen levels rise, potentially increasing the laxity of the ACL. Then in the second half of the cycle, progesterone levels increase, which may further contribute to ACL vulnerability. This surprising factor is often overlooked, yet it provides a critical piece of the puzzle in understanding why women are more prone to ACL tears. Now that we've uncovered these truths, what can we do about it? Knowledge is power, but it's what we do with that knowledge that truly matters. Now that we've delved into the shocking facts about why women are more prone to ACL tears, let's talk about what we can do about it. There's no magic bullet to prevent injuries, but there are steps we can take to reduce the risk. And the key to these steps is action. First and foremost, strength training is crucial. Building up the muscles that support the knee, like the quadriceps and hamstrings, can help provide stability and reduce the load on the ACL. But it's not just about strength. Balance and flexibility exercises are also essential. They improve proprioception, which is our body's ability to sense its position and movement. This can help prevent awkward movements that might contribute to an ACL injury. Next, let's talk about technique. Whether you're playing sports, working out, or just going about your daily activities, Paying attention to your body mechanics can make a world of difference. Avoiding sharp, sudden changes in direction, learning how to land safely from jumps, and maintaining a proper posture can all help protect your knees. Diet and overall health also play a role. A balanced diet rich in nutrients can contribute to stronger joints and tissues, and maintaining a healthy weight can reduce the strain on your knees. But remember, everyone is unique. What works for one person might not work for another. That's why it's so important to consult with a doctor or qualified healthcare provider. They can provide personalized advice based on your specific needs and circumstances. So, let's put this knowledge into action. Let's make these lifestyle changes, let's do those exercises, let's pay attention to our technique, let's eat those nutrient-rich foods, and let's consult with our healthcare providers. Remember, always consult with a doctor or qualified healthcare provider. Together we can tackle this issue head-on.